Sleep apnea is a problem of sleep and breathing that's due to repetitive collapse of the upper airway during sleep and is due to a combination of the size of the airway and the changes that happen when you fall asleep. If you think of the airway as a flexible tube that sort of runs from the tip of the nose down to the lungs, that tube is surrounded by soft tissue and muscle. Now when you fall asleep, those muscles relax and the airway narrows a little bit. When it closes about halfway, that's when you start to get some obstruction to airflow, which causes very turbulent airflow, causes the tissues to vibrate, and that's snoring. In some cases, the airway can completely relax and close off, and that's apnea. When that happens, no air can get in. As a result, the person struggles to breathe and eventually will wake up to get another breath. There are multiple consequences as a result of having sleep apnea. You're not able to breathe until you wake up. That disrupts sleep and causes people to be sleepy during the daytime. That puts you at risk for things like motor vehicle accidents and workplace accidents. But in addition, there are also some health risks that go along with sleep apnea. When you can't get air in, you also can't get oxygen in, and that causes the oxygen level in the blood to drop. This puts a lot of stress on the cardiovascular system, and people with sleep apnea are at higher risk of developing hypertension, heart disease, and stroke. If you are having trouble getting rested by your sleep, meaning that you're sleepy throughout the day, or that the same amount of sleep that you used to get no longer makes you feel rested, that's a suggestion that something is going on at night that ought to be checked out. In addition, if your bed partner or family members tell you that you snore very loudly and have pauses or stop breathing while you're sleeping, those are also indicators that you should get checked out to see if you have sleep apnea. The best way to detect whether or not someone has sleep apnea is to get an overnight sleep study. That involves coming into a sleep center where you can be watched sleeping. But it's not just looking at you while you're asleep, it's also measuring a number of physiologic signals to see what's actually going on. To get this information, we place a number of electrodes. These are small, painless sensors on various parts of the body to measure what's going on. Electrodes go on the scalp to measure brainwave activity. Others go near the mouth and the nose to detect breathing. Then there are some cloth belts that go around the chest and the abdomen to detect effort to breathe. At the end of the night, all this information is analyzed by a computer and then interpreted by a sleep specialist. After that interpretation, the sleep specialist will contact your physician to tell them what they found. The most common cause of sleep apnea is being overweight. So changes in lifestyle that lead to weight loss can be very effective. In fact, often case with sufficient weight loss, curative. Other options include a device called continuous positive airway pressure, or CPAP, that uses air to splint the airway open and prevent collapse. The entire apparatus consists of a little air blower that's connected to a mask through a tubing and is held on to the head with some straps. When you go to sleep, you put it on, and the air pressure keeps the airway open. When you fall asleep and those muscles relax, they can no longer collapse because the pressure in the airspace keeps the airway open. People usually find that they can adapt to this pretty quickly, and they are able to sleep comfortably and restfully through the night. There are a variety of masks, and it's important that the person chooses the one that's most comfortable for them. There are some that go over the nose, others that are small pieces of plastic that fit into the nostrils called nasal pillows, and other masks that cover both the nose and the mouth for people who have trouble breathing through their nose. Most people begin to see results from CPAP very quickly. Within the first day or two, your sleep is more restful and you feel more energetic during the daytime. Within a week or two, you should be back to your old self. I'm often asked, how long do I have to wear this thing? And the reality is that unless something changes to the size of the airway, apnea doesn't go away. Something that's very important to realize is that what happens at night has a big effect on how you are during the daytime. And people tend to be very poor judges of how sleepy they are. One of the big problems with sleep apnea is it causes non-restful sleep and therefore daytime sleepiness. If you're finding that you're starting to nod off when you're in a lecture or at work or sitting on the computer, or especially while driving, this is an indication that something is going on at night that's causing you not to be rested. And you should get that checked out.